So this class is designed for those who want to learn more about the warning signs of Alzheimer's and other dementias, as well as those who have noticed memory concerns either in themselves or in others. And so as you can see, these are the objectives. I have about 30 minutes to present a robust class. So my focus will be on atypical versus typical signs of aging, how to approach these changes, and the importance of early detection. I will briefly touch on parts of diagnosis, but mostly just as a precursor, as I know that's your topic for later. So again, let us know in the chat if you have any questions. All right, so the 10 warning signs. And so you've probably heard the terms dementia and Alzheimer's disease used interchangeably. While they're related, they are significantly different. And we're going to talk more about that. So first, we're going to hear from Heather Snyder, is going to discuss what dementia is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual. But there is also some overlap in behaviors among the types of dementia.
Alzheimer's disease is the most common form of dementia and accounts for more than 80% of all cases. Next, we're going to hear from Dr. Dean Hartley. He's going to explain what the disease is and what it looks like in the brain.
More than 100 years ago, Dr. Alois Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So lastly, we're going to hear from Ruth Drew. She's the Director of Information and Support Services at the Alzheimer's Association, and she's going to talk about the importance of recognizing the warning signs of Alzheimer's disease.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things, but when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So as Ruth said, it's important to know what the warning signs are and to be on the lookout for these marked changes. The Alzheimer's Association created a list of 10 warning signs to help with this and understand the difference between normal aging and not normal aging, and what could be common signs of possible dementia. This list is intended to help you as a tool identify changes in either yourself or the person that you're thinking of in areas of memory, thinking, and behavior. I want to emphasize that it's important to note that this list does not constitute as a diagnosis of Alzheimer's disease or another form of dementia. These are simply the most common signs experienced by individuals. Individuals can also experience one or more of these signs in differing degrees. So the disease looks completely different, and depending on the type, as we saw in our first video, those can be some like FTD or frontal temporal lobar degeneration often looks like mental health in the earlier stages, which is very different from Alzheimer's disease, where we think of that memory loss. And so this list doesn't constitute a diagnosis, but it's a starting point. And so let's explore each sign and see kind of what we should be looking for and what shouldn't be a concern. So first, memory loss that disrupts daily life. And so this is one of the most common causes and signs of Alzheimer's, especially early on, like I said. And this is, remember, forgetting recently learned information, not old information, but new information. Others include forgetting important dates or event, repeatedly asking the same questions. They might start relying on memory aids or relying on other people to do tasks that they once were able to do by themselves. Now, versus a typical age-related change would sometimes be forgetting information, but remembering it later. So the key is a recall. The second is challenges in planning or problem solving. And so some people may experience new difficulties in executive functioning, including developing or following a plan or difficulty concentrating. And so as we're talking about these signs, just remember what's normal for you if that's the person you're concerned of, or that other person. If this has always been an issue area, dementia might make it worse, but just be aware of what is normal for that person. Conversely, a more typical age-related is making occasional errors when managing bills or household finances as we get older. 3, difficulty completing familiar tasks. And so people living with dementia often find it hard to do daily tasks that once they did with ease. And so such things could be driving to a familiar place, writing a grocery list, remembering how to play a favorite game. It's usually those items that we kind of do on autopilot. We don't think about doing them anymore. Conversely, a typical age-related change would be occasionally needing help to use the microwave. Now, this often we find is because there's new technology all the time, like updates to Zoom, that sort of thing. We use it once, the next month it's different. So it's normal that if we didn't grow up in the age of technology, that these things just may take a little bit more time, and we may have to be taught multiple times before we pick up on it. 7, misplacing things and losing the ability to retrace your steps. 4, confusion with time or place. An individual living with Alzheimer's or another dementia may lose track of dates, the passage of time, seasons, especially if they're in a room that's hot, but it's cold outside. That can be really confusing if we ask them what season it is. They may have trouble understanding something if it's not currently happening, or becoming dramatic or profound in the middle to late stages. And so some of these things with confusion, it's very mild in the early stages, but then as we get to the middle to late stages, it becomes way more noticeable to us. And so a more typical age change would be confused about what day it is for a scheduled appointment, but figuring it out later. And so remember that recall is key. And so 5, trouble understanding visual images and spatial relationships. Some individuals with Alzheimer's or another type of dementia may experience vision problems. This can lead to issues with balance, trouble reading, and problems judging distance, especially in determining color and contrast with distance, which can all impact driving or navigating in their environments. So staying safe at home, so increasing that fall risk. Vision changes such as cataracts, that's a more typical age-related change that we would see. So this sign specifically shows us that it's not just about memory. It's important to think about other ways that dementia or those changes can impact a person's daily life and keeping them safe. So 6, new problems with words or speaking or writing. So new problems, individuals may have trouble following or joining a conversation. You might see that they stop in the middle of a conversation, they're frequently repeating themselves, or they forgot what they were talking about. They might also struggle with finding the right words. So they might start to use descriptive terms. And so they might say, I can't find my hand clock. And so we know that that's a watch, but they're losing that ability of that naming. And so they're starting to describe things. Versus a normal kind of age-related change would be occasionally having trouble finding the right word. So now 7, misplacing things and losing the ability to retrace our steps. This sign often causes concern in people. And I want to clarify that this is not just about losing your keys on occasion, putting your glasses down in a new place and that kind of throwing you off. Misplacing things from time to time, but being able to retrace your steps, or once you find the object, it kind of triggers your brain to remember that you put it there. That's normal. But a person with Alzheimer's disease may lose things and not be able to recall when it was last seen, the identity of the location that it was placed, or they may put things in unusual places, such as putting their shoes in the refrigerator, or my husband's grandma, she puts her jewelry in socks and she hides them places, usually the closet. And so obviously those aren't typical places that we would put those items. So that would be more of a cause for concern. And because of the lack of executive function and awareness, the person may grow increasingly suspicious of others and start accusing them of stealing, and do so more frequently over time. So, and then 8, decreased or poor judgment. So individuals may experience changes in judgment or decision-making, such as using poor judgment when dealing with money, paying less attention to hygiene and grooming. This is especially common in individuals who live alone, because we don't have that person to do the checks and balances for us or to remind us that that needs doing. Now, making a bad decision once in a while, such as forgetting to get an oil change for your car, that isn't typically cause for concern. All right, so number 9, this is a big one, guys. Withdrawal from work or social activities. And so individuals with Alzheimer's or another dementia may become confused because of all these other issues that we've talked about. And they may become suspicious, depressed, fearful, or anxious. They might get easily upset either at home or when out of their comfort zone. As we age, however, it is normal to develop kind of that routine and very specific ways of doing things. And so when that's disrupted, we can get irritable or upset. That's pretty normal. However, someone with Alzheimer's or another form of dementia may become fearful, angry, or easily frustrated, which is something that should be addressed. And this is disproportionate to whatever the trigger is. And so normally they might just get slightly irritated, but instead they're really mad, and that wouldn't be typical for them. You know, with these types of things, usually with the social activities and changes in personality, we might see that, for example, when you ask them, why aren't you going to see your friends anymore? You know, they might get angry. They might have excuses like, I don't like that place anymore. They don't do things the way I want to, when normally they would. And we start to see a lot of excuses. Keep track of that. Another thing that we can see is maybe you would like to go out to eat with them at a restaurant, and you notice that they're looking at the menu, and normally they're very decisive. They know what they want. Whenever they go to a restaurant and they say, you know what, I'll have what you're having, or I'll have the special, and there may not be a special. Those are common phrases. And so watch for that. If that's not typical for them, that tells us that their brain isn't able to track a menu. And menus are confusing anyway, but then it gets even more complex if there is any Alzheimer's or dementia going on. So next, we're going to go to the importance of early detection. And so the key is that we pay attention to what's going on with our own cognitive health and not dismiss any changes that we may be experiencing as normal aging. So we don't want to say, well, that's just normal. That's what happens when you get older. As well as for the others that we see around us, we want to pay attention. Any change that's unusual for your level of functioning or that of someone you care about is cause for concern. And so we definitely want to check into it. Many times, friends and family are the first to notice changes in someone's memory, behavior, or other abilities. And so we're going to discuss why it's critical to address any observed changes early and seek answers from a medical professional. And so sometimes the person, like we said, exhibiting it, they don't have that insight anymore, or that self-awareness. And some people don't have a lot of that to begin with. So know what that is for your person. So they may not realize these changes are happening. And so that's why your perspective or another person's perspective is critical. This is especially important if the individual is living alone or they're far away from family. And so what should you do if you notice changes in this person or in yourself? So if you continue to notice these changes, it's critical that you plan to take the next step and have a conversation with the person or others who are close to them about what you've noticed. This can be difficult or uncomfortable to have this conversation. And so the Alzheimer's Association has developed a roadmap, which we're going to go through next to help make this easier. So let's take a look. And so the first step is just we got to start assessing the situation. And so first, what changes in memory, thinking, or behavior do you see? What is the person doing or not doing that's causing concern? And write it down, even if that's just a simple bullet point. So 2, what else is going on? So are there other factors or conditions that could be going on? There are various conditions that can cause memory issues, also issues in thinking and behavior. So are there other health and lifestyle issues that could be contributing to these changes, such as stress, diabetes, change in medication, retirement, bereavement, those types of things? So what else is going on that could be impacting this or just making it worse? First, learn about the signs and the benefits of early diagnosis. And so you've taken a great step by being here because this can tell you all about these topics. And so education is key to finding a diagnosis and finding what's wrong. So do you notice any of these signs in the person that you're caring about? And so highlighting them in your handout, whatever that takes. What are you seeing? Has anyone else noticed these changes? And so talk with friends, family, a neighbor, maybe they have a coffee group, or maybe they're still working, and they have a work friend. And what changes have they noticed? Because they may see a different aspect. Now we have to prepare to have that conversation, and emphasis on the prepare. So who should have the conversation to discuss concerns? Who should be there? And this can be a very humbling process because it might not be us. It might not be you. So think of, is there another trusted family member or friend or a combination of both who can have that conversation? I used to tell families, is there a favorite child who just spews, verbal gold? Maybe that's the person that we turn to if they're on board. It's usually best though to start speaking one-on-one so the person doesn't feel ambushed or targeted, but use what you know about the person to judge what approach might work best for them and what would make them feel supported. So what is the best time and place to have the conversation? So when and where should the conversation be held? It's important to have the conversation as soon as possible. In addition to identifying a date and time, you should also consider where the person will feel most comfortable. Morning is usually the best time because we're well rested. If you know that their Mondays are very busy or their Wednesdays, trying not to have those days so you can have time to have the conversation. Thinking about, for me personally, I have no problem being vulnerable, but I don't want to get emotional in public. So I would, if somebody was going to have a conversation like that with me, my home or their home would probably be the best option. And just know what that is for the person. I've had these conversations with family members, and sometimes not looking at each other is helpful. So we might be sitting on the porch and we're not really facing each other, and that gives them a little bit of an ability to disassociate from the emotions, and so that they can step away and they can have a little bit of kind of privacy in that conversation. So what are you going to say? And so we've got recommendations on script. So making notes, writing down notes that you can say. Some helpful questions that you can consider are, I've noticed change in you and I'm concerned. Have you noticed this? Are you worried? Another might be, how have you been feeling lately? You just don't seem like yourself. Or I noticed you, insert a specific example, and it worried me. Has anything else like this happened? Offer to go with the person to the doctor. Ask the person to see a doctor and offer to go with them. Try using encouraging words such as, there are lots of things that could be causing this, and there are. Let's see if the doctor can help us figure out what's going on. The sooner we know what's causing these problems, the sooner we can address them. I think it would give us both peace of mind if we talk to a doctor. If needed, have multiple conversations. Don't be discouraged if the first conversation doesn't go as well as you thought, it's not as successful. Write down notes about how it went. so you can prepare for future conversations. You know, maybe you brought up driving and that, you know, was a big trigger for them. And so what are other issues you're seeing that can kind of get your foot in the door? Usually if they've mentioned it as being concerning, that is a fantastic place to start, because we already know that they're concerned about that and we can support them in that way, and the rest will fall into place. But practice. Absolutely though, don't dismiss the changes you're seeing just because they're reluctant to have the conversation. And just so you know, denial it's a very healthy thing for about 2 weeks. So once we're past 2 weeks, we often find that people are stuck and we have to help them get through the denial. And so they may just need a few days to think about what you've said, and then we can try having that conversation again. But no, some people are instant processors and some people aren't. If they're having some dementia concerns, they may need extra time to kind of think about that. All right, so reach out for support. So as you can see, there's lots of places. I mean, we're doing this class, and so the Alzheimer's Association, there's your Aging and Disability Resources, another example, obviously your doctor, but whoever they're in with right now, if they see other people that can get their foot in the door, we definitely want to reach out for support and build a big team, because we can't do it alone. So there's that's all free. So, and those other examples are free as well. Not going to the doctor, but you know, it's a necessary part. So finally, see a doctor. And so most people address these concerns with their primary care. However, some cases primary care may include some other specialists in for further evaluation. And so kind of some examples may include geriatricians. So these are individuals who have more training in medical care issues and conditions common among older adults, typically 65 and up. Others are neurologists. These individuals specialize in diseases of the brain and nervous system. Just so you know, not all neurologists, though, are specialize in Alzheimer's and other dementias. And so that might be a good question to ask when you're trying to set up that appointment. Neuropsychologists, these individuals can assess, diagnose, and treat psychological disorders associated with brain-based conditions. Psychiatrists, they specialize in disorders that affect mood or the way the mind works. So when you think about kind of psychology and mental health therapy, these are also your med providers. And so that can be done by other providers, but when you think mental health, psychiatry, those are those med experts. Psychologists, these individuals have special training in testing memory and other mental health functions. And these are the individuals that we would typically see in a diagnosis. However, there's lots of other individuals surrounding that within the medical profession that can help out. And so this is just a start. All right, so now we're going to talk about the benefits of early detection. And so what is that? And we're going to hear from Ruth again.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
All right, so now we're going to talk about kind of seeking a diagnosis, kind of the precursor aspects. And so who here thinks there's currently no way to diagnose Alzheimer's disease? So think about that. So that is actually, the answer is false, contrary to an outdated belief that Alzheimer's or dementia can't be diagnosed until after an autopsy. There are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's and dementia with a high degree of accuracy. And so, however, determining the cause of dementia can sometimes be more difficult, especially the longer we wait to get a diagnosis. Like I said, FTD looks like mental health, but eventually in the disease process, when we get a lot more symptoms, it can be hard to pick out where it started. So the earlier, the better. And so possible assessments that they're going to talk about later in much more detail, I'm just going to introduce it, may include a medical history, physical exam. They might screen for depression because that has a lot of the same signs. And their depression in older adults is much more common than we think, and which makes sense, just because there's a lot of other things going on at that time, and especially if they're feeling isolated. Interview with close companions, so that doesn't necessarily mean that that person could sit down, but sometimes families have said that they sent in a letter to the doctor noting everything they were seeing. Tests may include laboratory tests, mental cognitive status tests, and brain imaging. And so do dementia-like symptoms always result in a diagnosis of Alzheimer's? So kind of to end, many people wonder that. The diagnosis process will vary from person to person depending on the individual's specific situation and what the doctor feels is the right course for that person. The diagnosis may be something other than Alzheimer's or another dementia, which is why it's important to investigate the cause of the symptoms as soon as possible. Stigma and misconception about Alzheimer's, for example, nothing can be done, so why bother, can deter some people seeking a diagnosis. And we know, like with what Ruth said, there's so many things that we can do. And so also fear. And so let's make sure that when we approach it, you know, there is that compassion, because fear is a big player as well. And so that is it for my portion of it. And so let me know if you guys have any questions, anything I can clarify. I think I caught us up on time, so let me know.
Yeah, so please type your questions in the chat for Abby. We can address those. We have a few minutes here that we can spend on some question and answer. While we're waiting for that to roll in, I know a common question that we get, Abby, is what if the person I care about is showing signs but refuses to go to the doctor? Do you have any tips?
You know, I would say it depends on what gets them in the door, especially if they don't like the doctor. How can we make it a positive experience? And so bringing them, going with them is a good example. Another one could be, you know, it might sound simple, but hey, how about let's just go, I have to go to the doctor, try and set up your appointments together. I have to go to the doctor. Would you mind coming with me? Because I'm concerned about myself. And so getting them in the door. I know it might seem, some people say, well, I don't want to be dishonest to them, but remember what I talked about, they don't have insight. And so they don't realize this is an issue. If they did, they'd probably go in because they'd want to get it taken care of. Another one is make it a positive outing. And so, you know, if you have to travel to go to the doctor, say, well, let's go to your favorite restaurant and let's go to Shields or Dick's Sporting Goods. That's, a lot of people go there when they come into town, you know, places that they can't normally go. And then also just considering, you know, is telehealth an option for that beginning process? They've really, I mean, with the current climate, they've really upped some of those long distance services. And just seeing what is it for that person. And first, just address what is holding them back. If they're still kind of cognitively aware and you don't think that's the issue, what is the fear? And really addressing that fear and helping them get through that.